Good afternoon, everybody. My name is Anthony DeRosa, and I'm with the Derry Fire Department. Today, we're here to talk about diabetes and monitoring your blood sugar. The primary goal here is to teach you how to take a blood sugar, whether it be on yourself or a loved one that may or may not suffer from diabetes. Roughly 10% of America's population suffer from some form of diabetes, which oftentimes results in them having to monitor their blood sugar regularly, as well as take insulin. Diabetes is just their body's inability to regulate their blood glucose. So, moving forward, a couple things to consider is with a patient or a family member that you think might be suffering from low blood sugar. Symptoms may present, they may be suffering from being extra drowsy, not making sense of their words, slurring their words, extremely diaphoretic, or just not acting themselves. So if that's the case, what you're going to want to do is you're going to want to immediately assess their blood sugar. And what you're going to need to do so is some gloves. All right, we carry these on all our ambulances. It's not a bad idea if you're going to be checking blood sugar regularly at your house to have a box of these on hand. You can get them right down at your local CVS or Rite Aid. So you're going to go ahead and you're going to put these on. For the sake of the video, I'm not going to put them on, but I'm going to keep them handy here. The next thing you don't want to do is you're going to want to have some form of a glucose kit. So what we have here is our glucose kit, our glucometer that we keep on our ambulance. Inside this is the Microdot Extra, which is the actual tester right here. Then we have our test strips right here. We have a little lancets, some band-aids, and some alcohol swabs just to clean the surface. So first thing you want to do is you're going to want to pick a location. So typically on the patient, you can use any one of their fingers. If they are a regular diabetic, then oftentimes the skin's going to be real hard from testing on a regular basis. So we'll go into our little tester here. We'll get our alcohol swab. We're going to rip it open. We'll do it here. We're going to clean the surface. We'll do the side of the finger here. And then what you're going to want to do is you're going to want to let that dry. So I'm testing this on myself. Normally, as I mentioned, we would be doing this on somebody else. You can test yourself. But then you have your little lancet here. It has a protective tip covering here. So what you're going to want to do is twist that off. And now we've exposed the lancet. By pushing this down on the skin, it's going to cause this to retract, the lancet to advance, and it's going to puncture the side of the finger here. At which point, you'll have a little drop of blood. We're going to take our meter, open our test strip. We'll retrieve a test strip here. Insert it into our meter. And we're going to want to give this a second to zero out. So now it's all ready to rock and roll. So again, like we did, we punctured the side of the finger. We're going to apply a little pressure and we'll get a little bit of blood to the surface. We'll take the meter, absorb that blood onto the tip of the test strip, and it will calculate. This one counts down, and once it creates a reading, it will present right here on the screen. So ideally what we're looking for, an easy way to remember it is it's an upside down blood pressure. So you're going to want to be between 70 and 120. Now if you have a regular diabetic, then they're going to have an idea of where their blood sugar usually sits. So if it's low, you're going to want to encourage them to have something to eat immediately. You're going to want to do maybe some orange juice, a sandwich of some sort, some peanut butter crackers, something with a little bit of content. If it's high, then you're going to want to encourage them to take some insulin. So this is something that as a diabetic, they should be monitoring and regulating on a regular basis. If it's not something that they're doing on their own, or you feel that they're not capable of doing on their own, or you've seen them fail to do so as of recent, or their habits have changed, whether nutritionally they're not eating correctly or appropriately, then it's important to contact their physician or have them contact their physician to get this under control. So thank you for tuning in with me this evening. Hopefully I provided you with some information and made you more knowledgeable on the topic of diabetes and how to test the blood sugar.